Thank you. So my name is Jennifer Turner and I'm a member of the Cancer Connect Communities Project team, and I'm here today with Susan Gibson, manager of Derry Well Woman. So on behalf of Derry Well Woman and the Cancer Connected Communities team and my colleague Deirdre O'Neill, who couldn't be here today, she's on maternity leave, I would like to say thank you very much for this experience, and especially for the award. It's a recognition of the project and we can't thank you enough. So I'd like to start by giving you a background and a brief overview of the Cancer Connected Communities project. So the Cancer Connected Communities project stemmed from the knowledge and work of Derry Well Woman, which is a community health organisation established in 1988. Who provide services to women across the course of their life. And they recognised that we needed to hear more from people with lived experience of cancer. So what they did was they established the Cancer Connected Communities project, which started in September 21, and over the last 3 years we have connected to people living with cancer in the Western Trust of Northern Ireland, connected them to each other, to sources of support within their communities, and to those who can make a difference to how and where they receive services. So the project was the first of its kind in Northern Ireland and was developed with support from the National Lottery Community Fund, and the initiative brought together for the first time in the Western Trust 6 partnership organisations, and we had another partner who didn't benefit from the funding was the Western Trust themselves, and they were very much on board from the beginning because they wanted to hear the feedback from the people with lived experience so they could make the necessary changes. So the aims of the project were to enable people living with a cancer diagnosis to play a lead role in shaping a change agenda and to integrate care across the Western Trust. The Western Trust serves a population that reside in a vast geography that includes a large rural community with unequal access to community resources and support. We aim to reach these communities and other marginalised groups, as referenced in Section 75 of the NI Act 1988, for whom cancer services may be limited and for whom barriers to access exist. So, key to the success of the project was the fact that we followed a 4-tier award-winning model of engagement developed by Derry Well Woman. At Tier 1, we have programme delivery, where the project partners delivered programmes tailored to suit the needs of service users. We developed a bespoke effective listening for effective change training programme for frontline staff because we wanted to ensure that people were heard and their stories were captured. As Cheryl said earlier about the lady that she met and that comment about the leaflets in the folder, comments that people could have made, for example, at a complementary therapy session, it was important that that complementary therapist recorded and took note. For example, somebody said after their treatment they felt that they were falling off a cliff after they had finished their connection with the hospital, so to speak. And we picked up on that throughout the project, and it became important that aftercare was such an important theme, and it was important to look after people's mental health after their treatment. Through collaborative working, the partners extended their reach to various communities, including rural areas who benefited from having new services on their doorstep. At Tier 2, we had gathering session workshops where service users were invited to use their voice to influence change to cancer services. The workshops were attended by cancer patients and their families, and we had one specifically for the cancer workforce. And again, to refer back to Cheryl, it was important that we heard from all people in all areas, the admin staff, the clinical nurse specialists, the oncologists, and the radiologists, and to hear their side of the story and what barriers they were experiencing and what needed to change for them. Participants shared their experiences in a safe space and agreed consensus on core themes for change. At Tier 3, we had negotiate and change workshops. Those with lived experience attended roundtable discussions with representatives from the Western Health and Social Care Trust, the Department of Health, the Department for Infrastructure, and many other relevant organisations where the core themes were addressed and change was negotiated. At Tier 4, on the 20th of June this year, we had our Commitment to Change conference. The change requests agreed at the negotiate and change workshops were presented and documented. The format was Q&A, where service users requested a change and the relevant organisation responded with a commitment to change and the work that was underway. The project has demonstrated the power of working in partnership and how to engage effectively with lived experience, develop connections and influence those who can shape services. The unique model used, the diversity of the partnership and the bravery of all the service users who have been the main contributing factors to the project and enabled us to support and engage with over 2,700 people who have been affected by cancer living across the entire Western Trust geography over the last 3 years. So we're going to play a video now where you get an insight into the service users and hopefully it works.
The unfortunate reality for us all in 2024 is that 1 in 2 people will now develop cancer. 10 years ago that was 1 in 4. And here in the Western Trust in the last 4 years, over 11,000 people have been diagnosed with cancer. We are in a rural community. We have unequal access to community resources and support. And not only that, the pandemic absolutely created enormous issues for people diagnosed with cancer during that time. And so through the Western Cancer Locality Group, we developed cancer-connected communities. This is the first time that multiple charities, along with the Western Trust, have come together to ensure that service users were upfront and central in influencing change and how services were delivered. And so out of that came cancer-connected communities, so that those who were affected by cancer could attend their local charity, be that Action Cancer, Advice Northwest, Cancer Focus, Care for Cancer OMA, Derry Well Woman or Swell in Enniskillen.
I was diagnosed on the 16th of July 2021, 3 months after I got married and a month after I just turned 31.
I was diagnosed with cancer back in 2015 and I found that there were no services in my local area, but I discovered that after my treatment, and I felt like I fell off a cliff and there was nobody there for my family or my children.
And that's what sort of provoked Genevieve to, and myself to, I suppose, try and create a venue like this.
The trauma that they have went through in their life, the loss, the sense of loss, even though they have gone through their cancer, their life as they knew it has been lost completely.
I was diagnosed with breast cancer and I had 3 young children under 5, and I'm sort of tested. I didn't know how to cope at all. I was coming out of the hospital and I said, oh my God, what am I going to do? Just didn't know what to do.
Care for Cancer were based in Oma and was started 35 years ago by a lady, Joan Hamilton. And Joan set it up after her husband passed away with cancer with the help of her friend, because she found there was no support at the time her husband passed away, and it's grown from there.
Derry Well Woman had developed a model of engagement whereby you engage with patients and clients at the point of their service, where they're coming and receiving services.
The WELL programme was a lifesaver too, a 6-week course of teaching us, wasn't it? How to live our lives, how to deal with everyday life and how to deal with our anxiety regarding the breast cancer.
It became obvious that there was a lot of new emerging cancer support groups within the community. There was also, for 8 or 9 years, the development of this wonderful cancer centre here in Altnagelvin. Well, the whole notion of developing a cancer-connected communities across the Western Health and Social Care Trust came out of the Cancer Locality Group. And we also were aware that other community groups, apart from Derry Well Woman, were developing support services, which was a trust-wide partnership.
I suppose we had an idea that we obviously needed the money to help provide the charity with their services, but I suppose We were explained what was going to happen, and from there we sort of thought, well, yes, this sounds really good, and it'll give us the opportunity to meet other people within the other partners then as well.
Because I can't exist without collaborating with the larger charities. Through those workshops or negotiating change, our clients actually had, and probably for the first time ever, the opportunity to sit at round tables with the Department of Health and with the healthcare professionals and other charities, you know, to get the issues across directly.
They then offer courses, and the courses that I availed of in particular were those run by Cancer Focus and by the Derry Well One, the Well programme, which was fantastic.
How can we better communicate to our patients, carers and families? How can we better signpost them? Because obviously the trust alone can't provide the services that's needed right across the board, and it's how we actually signpost our patients, carers and families to the voluntary sectors and getting them access to the various support mechanisms that's out there.
The use of the services closer to home means that, you know, people don't have to travel. If they've gone to Altnagalvin for their treatment, they're not having to go back there for an appointment again.
So it's the after effects of the cancer, because we can't travel from here to Belfast or Derry without a break to go to the toilet.
And sometimes it's that thing that they avail of in here is keeping them going from day to day. And it's giving the people back a life that they thought they'd lost and would never get back again.
Do you know, going through your treatment, it's always from your consultant or your nurse of this is what you're doing. I needed people like me. I needed people that understood what I was going through. Whenever we done the workshops, it was our voices being heard.
Well, the part that I found the most difficult in the whole situation was whenever you were discharged from the hospital. You just felt very alone and you had no medical backup there at all.
You're trying to come to terms with the shock of your diagnosis, the effects of your surgery, the effects of your treatment, the changes to your body, the ongoing effects of the medication you might be on, and you're in a very dark place.
By listening to them effectively, you can actually influence change if it's escalated to those who commission and provide services.
And obviously we have challenges in terms of growing demand, etc. But it's what we can do in terms of improving the patient pathways to make it more streamlined, to make facilities as close to home as possible where we can.
Because the people who can make changes have actually heard the issue directly from the clients themselves, that they will make those changes, and some of those changes are very simple. I can see a future, you know, and something positive definitely from this project.